Obamacare is rife with so many issues and so many inherent mistakes. Americans are screaming about the quality of their health care, far too often managed by incompetent doctors or those who simply are forced into not caring by a system that makes it tougher for them to dole out consistent care each and every day. Now, the Obama administration today is seeking to do something about it. Question is if it is the right thing for them to do, because the administration now wants to transform over the next 4 years the way that Medicare, the program, pays out for doctors and hospitals, rewarding providers that achieve better outcomes for patients rather than those that just do more. It's a move away from a so-called fee-for-service medicine, and this is a central goal of what the president signed into law 5 years ago. Many people who are following this believe that this is critical to improving the quality in the care of patients that they're getting right now and restraining the costs. This is where a lot of the baby boomers are now entering the nation's primary insurance program for the elderly. But this comes down to an issue that the American people themselves need to be able to talk about and decide what is important to them. The quality of the health care, not necessarily what you pay, but the quality of it. Let's welcome back to MidPoint, former Lieutenant Governor for New York State, now Senior Fellow at the London Center for Policy Research, Betsy McCaughey joins us. Betsy, good to talk to you again.
Well, thank you. And I'm glad you're raising the issue of quality because yesterday's administration announcement about Medicare means lower quality for seniors.
Now, why does it mean lower quality when the Obama administration claims that what they're doing with Medicare now will force the doctors to provide a higher quality? Where's the difference?
Well, it's very interesting. It's their Orwellian vocabulary. They're really equating cheap with quality. They've redefined the word quality to mean lower cost. Here's what they're doing. They're giving doctors and hospitals a fixed lump sum of money to pay for a group of seniors and telling doctors whatever money they don't spend, they get to keep part of that for themselves. They call it savings. But what it's going to do is encourage doctors and hospitals to skimp on care. This is the old HMO model rewrapped.
Betsy, isn't it, though, part of what we need to be concerned with? You're right about this with regard to where all this money is going. But don't the consumers need to be more concerned about the quality of their care they're getting and have a way to know that every doctor, no matter what they're going in for, whether it's a general practitioner or whether it's a cancer researcher, that they are doing the absolute best? Because I will be very honest with you, I have seen people recently who are going to doctors and the doctors are shoveling them out of the office. They just could care less and they want to get them out, collect their money and move on to the next patient.
Well, that's right. But here's the answer to that. Collect data on actual quality measures, infection rates, for example. Nobody should contract an infection when they go into the hospital. And I agree that it's right for Medicare to pay doctors and hospitals less or penalize them by not paying them at all if the patient gets an infection. But that's not what they're doing here. They're just saying, spend less and we'll give you part of the savings. It's a hatchet. It's not a scalpel. And what it's creating is a conflict of interest between you and the person you need to trust the most, your doctor. In the future, when a doctor says you don't need that test, you don't need that treatment, you're going to wonder why, whether it's because that's the truth or because the doctor is going to reap part of the savings from you going undertreated.
I got about 30 seconds left. I did want to get your comment on the CBO report that is out right now. According to this report, it's kind of buried in a 15-page section of the forecast that Obamacare will cost the government $50,000 per person.
That's over 10 years. The real story in the CBO report is that Obamacare is going to add $1.3 trillion to the deficit over the next 10 years. Remember when the Democratic Party said you can't repeal Obamacare because repealing will add to the deficit? Now the shenanigans behind those tricky numbers is becoming apparent. The fact is that repealing Obamacare will set us on the road to fiscal responsibility. Ah,
that word shenanigans. We've heard that before when it comes down to the Affordable Health Care Act and government. I'm sure we're going to hear it a lot more, unfortunately, for the next couple of decades. Betsy McCaughey, always a pleasure to have you on the show. Thanks so much for joining us and giving us some insight. All right, take care. Spanning the globe and finding evidence of civilian casualties that Vladimir Putin and the rest of his cronies would prefer the world not see. That's coming up next, right here on MidPoint.